Hello, everyone, and welcome to Moments in Medicine Live, a weekly chat hosted on Nebraska Medicine's Facebook page. Today, I am lucky to be joined by Nebraska Medicine surgical oncologist, Dr. Maxwell. Thank you so much for joining us today.
Thank you for having me.
I always give a little disclaimer. First off, I'm Heidi Woodard. I'm back. We have some new talent in the department. I'm sure you've met her, Christine. We've got Kayla. We've got a new girl who I won't even announce her name yet, but she might be doing Facebook Lives in the future. So thank you for letting me join you again today. As we begin every discussion, we always remind our viewers that the information we're sharing today is to be used for informational purposes only. If you have questions regarding your specific medical plan, your course of care, please direct those to your doctor. I am not the doctor you need to be talking with. So she has the expertise. And today we're going to be talking about mammograms. We're going to be talking about oncoplastic breast reconstruction, which that's a big mouthful, but you're the expert when it comes to that. And always remember, I'm going to keep my phone in front of me. You can comment during the live chat. Just add your questions and feedback below. If we don't get to them during the live chat, we can also monitor them after the fact, and so we do try to get back to you with all the answers. So first things first, this is a very busy time of year for everyone. I know I kind of fit in the target demographic of moms that we try to reach, and lots of activities. I guess that when we do have nicer weather, a lot more outside activities. And I think we struggle as moms and as women in general with just making the time to get screenings done. So let's start off by defining a mammogram. It's an image of the breast used to detect breast changes in women who have no signs of breast cancer. That's the screening mammogram. Can you walk us through the types of mammograms that are provided in Nebraska Medicine, how we try to make it more convenient for patients to get those?
Sure. So all of the Nebraska Medicine screening mammograms are actually 3D mammograms, which is a newer technology, gives a much sharper image of the breast tissue. And we actually do our mammograms at 3 locations, at our main campus location, our Village Point location, and also at Bellevue. So really easy for people to get there no matter where they are in the area. And there's also the option for online scheduling, which is at the Nebraska Medicine website, nebraskamed.com/mammo. And you can also call to book appointments for screening mammograms. And the phone number for that is 402-559-5600.
Awesome. And I know I've been a patient of both the traditional and now the 3D, and the experience was pretty much the same. We shouldn't expect anything new.
Right.
It's just advanced technology.
It's the pictures that are different, not the actual mammogram experience. Exactly.
Sure. So I was lucky enough, when I came on board last fall, we were ramping up for an event that you were so essential to bringing to Nebraska Medicine. It's the Breast Awareness Reconstruction Event, or BARE for the acronym. Talk to us about what that event's about. You were from Canada and you had participated in it in Canada and brought it here to Nebraska Medicine. I got to sit in on it, and it was a powerful, powerful event.
Yeah, this event is one of my favorite things that we do all year. So it is a breast awareness and reconstruction event, and it's done in various iterations and under various names all over the world. But essentially what it is an educational event for women who are newly diagnosed with breast cancer, who haven't had their surgery yet, or women who are high risk of developing breast cancer, for example, women with BRCA genetic mutations or other genetic mutations, as well as their family members or their support systems, their loved ones. And this was something that when I was in my training for my breast fellowships, I was involved in Canada and was really excited about it and thought it was really wonderful and powerful. So I was really excited to bring a version of that here, and we partnered with Project Pink to do that.
Yeah, I know that they were highly invested in this
Yes,
as well.
yeah.
It was a magical evening. We did 2, one in October of 2018, one in just March of 2019, April 2019. And we not only had the patients there, but as you mentioned, the support people. And one of the people who stood out the most to me was a husband of a breast cancer survivor who went to the event first time around and then turned around and modeled the second time. And he's there talking about not only what the event meant to her, but how it helped him in knowing, a lot of times the support people are the ones that don't get remembered as much as the patients themselves.
Yeah, so one of the biggest and I think most important and really powerful parts of the event is that we actually have a modeling portion of the event for the women, for the patients only, in which women actually who have been through it will actually meet with the women in a private setting, show them their surgery results, talk about their experience, talk about what it's like to go through it all, how to get through it. And I think that that's one of the most powerful parts of the event. And the family that you're talking about, she was actually a model both times at the event.
That's right.
And her husband and son, who's quite young, I think he's 10 or 11, reached out to us and said, you know, we would really like to be involved to help people and families who are going through this talk about what it's like as a loved one watching your wife, your mom, your sister, your whoever go through this. And so he actually spoke up at the event this time around, and I thought that was a really powerful thing. And I think that so important to remember that it's not just one person who goes through this diagnosis and this whole process, it's the entire family or the entire group, all of the loved ones, all of the support system. So we need to find a way to support the support systems so that everyone can be strong together as they go through this challenging time.
Yeah, I thought it was just really cool for Nebraska medicine to recognize, you know, we talk about the multidisciplinary care, so you have all these doctors that focus on the patient, but above and beyond that, you do support the family, which is awesome, because a lot of times, if it were me, I'd be kind of on the outskirts just wondering if I was keeping everything organized in my head, and am I telling all my relatives what they need to know, and this was definitely demonstrative that you included everyone. And if you have any doubt that she was originally from Canada, you just have to hear her say process.
Oh yeah, that's true. That is true.
Okay, so you are a fellowship trained, and again, for lay people like me, the fellowship is just an additional training specialized in both breast surgical oncology as well as oncoplastic breast surgery.
Right.
So can you describe the term oncoplastic surgery, the technique behind that? Because it's very special from what I've researched.
Sure, yeah. It's, I think, a really exciting kind of realm in breast cancer surgery, and it's really talking about for women who have lumpectomies, so breast conservation where we just remove the area where the disease is, but we preserve the rest of the breast. It's using their own tissue to rearrange and make sure that they maintain a good contour to the breast, that they don't have a pucker or a divot. And if we're taking out a fairly large area of the breast, it could be involved in lifting the breast and also potentially reducing and lifting the opposite breast to balance them so that they have symmetrical results.
That's awesome.
Yeah.
Okay, so you, along with all of our other specialists, we have these introductory videos on our website, which is pretty cool because when you're kind of shopping around for a doctor, it's nice to have a video and to hear a voice and to see a person to see if you feel like you'd be comfortable with them. So talk me through, in your video in particular, you talked about having an interest in medicine from a very early age, and that in turn blossomed into a love of working with breast cancer patients specifically. Can you describe the types of surgeries that you can offer those patients based on their individual treatment plans?
Sure. I think that that's one of the things that's so overwhelming about a diagnosis is that there's so many options for treatment, and you can feel a little bit stranded and a little bit paralyzed with the kind of wealth of decisions that you have to make and all of your options. And it's really important to narrow down what's right for the specific patient. And I think one of the things that I tell everybody is, unfortunately, breast cancer is so common. And so everyone knows someone or has a loved one or a sister or a friend or a cousin or, you know, a friend of a friend that's gone through it. So when women get diagnosed with breast cancer, often what happens is all of these opinions start coming out of the woodwork. You should have this. How come you're not doing this? Well, my friend had this. How come you don't have this? Or how come you have to have this when so-and-so didn't have it? And so I think really consulting with your team about the plan for you as an individual is the right way to go. And that's why I think the multidisciplinary approach that we have here is so nice for patients, because they get kind of the one day, one plan, they know what their next steps are. From a surgical perspective, you can kind of divide the surgeries into two main categories. One is lumpectomy, or sometimes called partial mastectomy, what we just talked about with the oncoplastic part of the surgery, where you remove just the area where the disease is, but you preserve the rest of the breast. And then the second option for breast surgery is a mastectomy, where you remove all of the breast tissue. And that can be done with reconstruction, sometimes at the same time as the mastectomy as the cancer surgery, sometimes without reconstruction. It really all depends on patient preference, whether or not the patient is a good candidate for different types of reconstruction. So there's really a wide variety of surgical options that really have to be narrowed down based on a patient-by-patient approach.
Well, I've been fortunate to meet you and the other members of the team, and you know, from consumer standpoint, we don't just consider you guys as the end-all, be-all, the know-all. And in my opinion, you know, I get to know you as people, and it's very comforting to know that you can bounce ideas off of Dr. Benyon or Dr. Tandra or, you know, all these other people on the team. And it doesn't have to be a one-size-fits-all. It shouldn't be.
Absolutely.
It should be based off of the individual treatment plan. So that's very comforting to know. You talked about how common breast cancer is. Unfortunately, I'm sure many have heard this, The statistic is 1 in 8 women will be diagnosed with breast cancer in their lifetime. However, if caught early, can you explain how the chance of survival is greater and that the patient is afforded more treatment options?
Absolutely. So that's one of the important things about getting screening mammograms and really keeping up to date on those, is because when breast cancer is caught early, it has a lesser chance of being metastatic, so spreading to lymph nodes or anywhere else in the body. And we know that if breast cancer is caught early, then the overall survival at 5 years and 10 years is really, really good. It also keeps our options much wider open, because if it's caught early, my surgical options are greater, and the options are dictated then by both the disease process, of course, but also patient preference and what works best for the patient. But if someone presents with significantly more advanced disease, our options begin to narrow, and sometimes there's only one type of surgery that's available rather than multiple types, or a specific type of chemo done at a specific time and maybe not even surgery. And so as the disease becomes more advanced, doesn't mean that there aren't options out there. It just, the options begin to narrow a little bit.
Absolutely. And again, catching it early, we'll go back to the importance of a mammogram. Go online today. Make the time to get online today. She mentioned earlier, it's the nebraskamed.com/mammo. I know we have a story that we're featuring really soon that's going to be emailed out to consumers that talks about a woman who it wasn't even felt to the touch, but that mammogram caught it. And I think sometimes women think, well, everything feels okay, and that might be some of their hesitancy going in. And
that's the beauty of doing a screening mammogram, is that most lumps actually have to be a couple centimeters in size before anyone can feel them. And so mammograms can find things that are 0.5 centimeter, 2 millimeters in size, really tiny. So well before anyone could ever feel anything, including your doctors, before your doctors could ever feel anything. The mammograms can show us that. So that's really what allows us to catch things at very early stages.
All right, so you talked before, you're invested in making sure that your patient decides on the treatment approach that is right for her. Can you walk me through, let's say I'm the patient in the room. What are some of the questions that you ask the first time you meet someone?
So one of the big things that we talk about is their own history. So there are specific questions that you ask to kind of try to gauge someone's overall risk of developing the breast cancer in the first place, but future risk going forward. Things like family history, trying to determine if someone is eligible for genetic testing, which is a blood test that looks to see if women carry a high-risk genetic mutation like the BRCA1 or 2 mutations. Those are probably the most commonly known ones. So we talk about that. We also talk about what their current options are based on the size of the disease, the biology of the disease, what the treatment plan is in relation to things like chemotherapy or radiation treatment or surgery. And then we kind of sit down and talk about, okay, what works for you? There are lots of different options, and it's such a knee-jerk reaction to come in and say, I need a double mastectomy. And that's what we hear a lot. But that might not be the right thing for the disease, for someone's lifestyle, with the recovery that goes along with that, all of those things. And we also try to consider kind of the whole mental and emotional, I'm going to say process again. I don't think I could say it the other way. But the whole mental and emotional process that goes along with that, and how people are affected by that. Because people sometimes think, well, it's okay, they're just breasts, it'll be gone, and I'll have a reconstruction, and I'll be just fine. And there's a lot, it goes a lot deeper than that. There's a lot of mental adjustment, emotional adjustment that comes to such a big change in your body, and it really has to be the right decision for the person and for the disease when we try to make those decisions.
Sure. Well, is there anything else you'd like to address today? You did an excellent job.
Thank you.
She's great at this, I'm telling you. Okay, so I didn't see questions come through just yet, but we'll continue to monitor, like I mentioned. So if you have a question, even if you see this after it runs live, please chime in. We're more than happy to address those questions. I'd like to give another thanks to Dr. Maxwell for joining us here today. And to find a Nebraska medicine clinic near you or to book an appointment, you can call 402-559-5600. And remember, you can also find more information online on nebraskamed.com. Thanks for watching, and remember to join us next week for Moments in Medicine Live.